Hi, I'm Danica Koopmans.
And I'm Sharon Hughes-Geekie. We're your hosts of Docs of Vernon. This is an interview and podcast series designed to help you navigate the healthcare system and get to know the physicians that provide your care.
Topics include what the heck is a hospitalist, treating addictions, and alternatives to going to the ER, plus so many more.
This is your link to healthcare in your community.
Hello and welcome back. Thanks so much for joining us today. Today I have the privilege of interviewing Dr. Alex Mantha. She's a CCFP-trained family physician. She's also taken on new leadership roles in our community and hospital setting. And she currently has been doing, or I guess not currently, but you're always involved in the PQI projects, one of which I really want to talk to today, so that's exciting. The other thing that is very cool and unique about you is she does, I guess it's kind of like volunteering at the ski patrol team as a physician at Silver Star. She also does sports medicine through the Alpine Canada, what do you call it? Ski team, snowboarding?
Ski racing, the Ski Racing Alpine Canada team, and then just different events with Snowboard Canada.
Cool. So welcome, and thank you so much for doing this with us.
Thank you for having me.
So back to the PQI project. I wanted to talk and have you just share a little bit more because it's a topic that I think a lot of people maybe don't know much about or who have had maybe not the best experience with. I would say rarely people are having an excellent experience with this conversation. And it's a conversation around most forms. And your PQI project was making the most of the most.
Yes, absolutely. So what a most form is, just to start, is a medical order scope of treatment. And what that is a document that we fill out as physicians. I'm a hospitalist in Vernon. And when a patient is admitted to hospital, we take the time to have a conversation with them about their goals of care and the direction of care that they would want if something were to happen, like their heart were to stop or if they were to stop breathing. So this most form is basically a reflection of that conversation. And a few years ago, practicing here in Vernon, I had an experience in the middle of the night where a patient acutely decompensated, and I went to the chart and there wasn't a most form in it. So we began kind of the pathway of resuscitation. I called the family, couldn't get a hold of anyone, and then finally when we did get a hold of somebody, the family member said that, ultimately this patient wouldn't have wanted to be resuscitated. So I kind of took that on as a personal project of mine to make sure that any patient that I was involved in, that this form was completed. This form basically kind of guides patients and their families in terms of what they would want if, again, like they were to stop breathing or if their heart were to stop. And it kind of categorizes it into medical treatments and then critical care interventions. There's a part 2 section which kind of elaborates a little bit further in terms of blood transfusions, dialysis, non-invasive ventilation, and nutritional support. So today I was just hoping to kind of go over those things and to give you guys a better idea of what this form is and discussions that you should think about having before ending up in the hospital with an acute health crisis. And that's because our minds work better and discussions happen better in a situation and an environment outside of the hospital when there's time to think about it and to discuss it with family.
So is this a form that can be completed then with their primary care provider?
Absolutely. So the most form was launched in Interior Health in 2015, and it's widely available. So if you Googled like most form Interior Health, you would get it. The way to have kind of this form officially in your record is to have that discussion with either your family physician, a nurse practitioner in the community, or somebody when you're admitted to hospital or come into hospital. This form is part of advanced care planning, and it has been a major push just with, again, informing the public about advanced care planning. So there are some resources on the web offered through Interior Health as well called My Advanced Care Plan. And that's just like a website and a workbook that you can work through to really think about what you would want in these situations.
Yeah, I think you alluded to a really good point there, that the MOST form is really not just about your physical well-being. It also encompasses your spiritual, your emotional, your mental, past experiences with health care, like the system, your family, your wishes when you were young to when you were older, and how that's evolved over time. And yeah, I think that's a really good point to make, is that when you are thinking about it, think of yourself holistically, right?
Absolutely. Mm-hmm.
Yeah.
And to kind of like take that one step further too is, you have these discussions, and hopefully you're having them when you're not in one of these crisis state situations for yourself or for one of your family members. And usually, you can fill out this form, you have a good idea of what you would want. Sometimes your health changes, and those are always good times too to reevaluate, like, what are your goals of care? Again, it should be a reflection of what you would want. This is a form that represents your wishes at the end of your life. And you want to make sure that that's available to your family that is making decisions for you if you're unable to, and your healthcare team.
When it comes to the MOST form, is it written in stone? So say I fill it out today and I decide, no, actually I don't want that, or I do want that. Can I change it at any time?
Absolutely. So, the only thing that would be required is you having that discussion with someone so that it is updated and faxed to the MOST office, and that is ultimately updated to your electronic medical record system called Meditech, which is the interior health version. So for us as healthcare providers, we can access those MOST forms that were provided from community family physicians or NPs. So we have all the historical ones, but if one day you decide I want critical care intervention, that's everything from intubation to CPR to defibrillation and a stay in the ICU. If one day you want that and then something happens and your wishes change, we update it. It's no problem at all.
Yeah. So I want to switch up gears for a second.
For sure.
I told Dr. Mantha, let's just talk about this because this is amazing. Rarely do we meet somebody who's actually working in sports medicine. And this has been something that's kind of, you look back on your life and you say, how did I end up here? But I could see how this evolved for you, because essentially she was skiing at 3, growing up on the ski hill, and now is working on the ski hill with other athletes. If you could just share, because you just did something at Big White this weekend, share a little bit about what that's like, what your role is in that.
Totally. So my kind of introduction into the sports medicine world was through Alpine Canada. So I traveled with the Canadian ski team for 6 weeks. And I traveled to different World Cup events, and basically I was acting as the team physician. So you do everything that you would in a normal kind of family physician's office. So you're managing like just random illnesses and that type of thing. Then you're also on the ski hill. So you go to the top of the course, you do training with the athletes, you go to races. As the team physician at a race, you're basically one of various physicians from different countries. And your role ultimately is to advocate for the patient in whatever situation that you're in whatever country you're in. That was a huge opportunity for me to kind of blend my passion for medicine and ski racing. And I've got to travel to kind of various places around the world as a result of that. That led kind of into other sports medicine roles. So recently I was the event physician at the Para Snowboard World Championships at Big White, which is a super fun, amazing event that showcases these athletes that have been through major hardships that just persevere through everything. And that kind of blends, again, the world of skiing, snowboarding, and medicine. And I take that also back to kind of my everyday winter life in Vernon by working with the ski doc program here at Silver Star. So those are things that definitely bring positivity to my life and kind of explore like the other sides of medicine that you wouldn't know exist when you're in medical school or residency.
Yeah, absolutely. I think that's a huge point for medical students and residents, or even anybody thinking about medicine. It's just there's such a breadth of capacity to which you can really take your career.
Absolutely.
Yeah, you've blended that well.
The options are endless, and ultimately just getting involved in your community in any way will open doors for you, whether like personally or professionally. And Vernon is a place that kind of has allowed me to do that, just develop my professional career in different capacities, and I feel very supported by the medical community here, for sure.
Yeah, we are so grateful to have you.
Oh, thank you.
She's so awesome. Anything else inside the interview that you want to share with the public or medical students and residents who might be watching?
One thing I did want to bring up is something called the Green Sleeve, which is available to people across BC and actually Alberta as well. And it's an envelope that you stick on your fridge. That envelope should contain your most form and any advanced care directives that you have. Paramedics, when they do enter your house, if you are having some type of health crisis or a family member is, they know to look specifically to the fridge for this green sleeve, which contains this information. The most up-to-date most form should be contained on your fridge. And again, it's just a quick place to store these documents that people know to look for them, and they will bring that envelope with you to the hospital. Again, if you're unable to have the conversation or a family member is not available, that information should be contained within the green sleeve. So that's something else you can Google, green sleeve, interior health, and just an important thing to know to make sure that your wishes are correctly followed if something were to happen. Come to Vernon. We'd love to have you.
Love to have you.
Join our team. Hospitalist team, family physicians, if you're a specialist. We have people from all backgrounds, from places from all over the world, all across the country. And Vernon is a community that is very welcoming and very supportive. And really does let you grow as an individual, personally and professionally, especially if you like the outdoors. So mountain biking, skiing, cross-country skiing, lake life, hiking. What more could you ask for?
I agree. I am with you. Well, thank you so much for coming today and being here. If you guys want to talk to Dr. Mantha, or you want to get in touch with us, or this is something you want to learn more about, sports medicine or Vernon, please reach out. You know how to access us. All the links are below. Thanks so much. Bye for now.